It's 7 o'clock. The meeting is called to order. I'd like to welcome each and everyone here tonight. And if you would, please stand for the pledge of allegiance and remain standing for a moment of silence, please. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Be seated, please. Do we have a motion to approve the agenda as presented? Motion by Mr. Davis, second by Mr. Jones. Those in favor say aye.
Aye.
Those opposed, no. Motion passed. We don't have any addition to the agenda, I believe. On the consent agenda, would anyone like to remove any item for discussion? If not, do we have a motion to approve? Motion by Mr. Farrell, second by Ms. McClurkin. Those in favor say aye.
Aye.
Opposed, no. Motion passed. Dr. Bird, Director of Instruction, report.
Thank you, Mr. Marty. As you are probably aware, the Department of Education yesterday released our state and district 3rd and 7th grade TCAP data from this past spring. And we are excited that our students showed mastery at higher levels than the state average, despite, as you know, overcoming some obstacles from last year. We ordered our Chromebooks in the summer. We didn't get them until the end of the year. And then the number of distance learners we had, we started out with about 30%. We were down to about 14% by the end of the year, as well as some other factors. But we are proud of the work of our teachers and students. But we know that there's also some work to be done ahead of us to address learning loss. And we're going to continue to work diligently on that, as well as to close the achievement and growth gaps, in our subgroups. Tonight, as part of my report, I have Melissa Chipman and Coach Fields who will be presenting. The schools have begun distributing Chromebooks to students across the district, as part of our strategic plan. All students in grades K-12 will receive a device this school year. And so Melissa Chipman, who is our instructional technology coordinator, she's going to talk to you for a few minutes about internet safety measures that have been put in place. And then Coach Fields, who is our pupil services supervisor, is going to share some enrollment information with you from this week. So I'll bring Melissa up.
Rebecca, can I
Yes.
ask you a question?
Sure.
I think so.
I was going to come back to questions.
Okay, well, let's do that.
No, go ahead.
I was just gonna ask you, talking about the Chromebooks and stuff, how are we going to implement that type of virtual learning in this year? Are we gonna keep using Edgenuity and all that kind of stuff?
So we're not.
Other plans?
Okay, so we're not offering a virtual or a distance learning option this year. We're full face-to-face. But yes, we have Edgenuity for some online work, remediation, that type of thing. We still have that and teachers can still use it, but we're not offering the virtual option per se like we did last year because all of our kids are face-to-face.
Well, are we encouraging our teachers to make good use of the technology?
Yes, absolutely. So we had in-service last week, and as well as during the summer, we've had different technology trainings for teachers. And so during, August, I guess it was the 5th and 6th, Thursday and Friday, one day we had all the 612 teachers at a technology conference all day. There were about 20 sessions that they could go. They could pick the ones that they needed help with and receive training. And then Friday, August 6th, the elementary teachers were there. So yes, we are encouraging them to use that, not just Edgenuity, but many instructional tools.
Okay, thank you.
You're welcome. Anything else? All right, Ms. Wilson.
I'm going to discuss the internet safety measures we have in place that go along with our board policy 49406. As we're beginning the year, we're going one-to-one, as you all know, and we're trying to make sure that we keep the kids safe as well as they're using these devices and everything. So Some of the things we have in place, we have the content filters that we've had in place all along for in-school use with the devices that we had in school, and now that we're rolling out one-to-one to cover those devices as well. We're implementing a classroom management program that will allow the teachers to monitor what the students are seeing on their devices while they're in class, teaching class. They can push out sites to them as well and close the sites if they're watching that they may not need to be. So we're rolling that out now and about to train teachers during the services on that. Email, we're protecting the students the students can only right now email within the Tipton County domain. They can't send an email outside the district or receive an email from outside the district. We are opening a few educational domains so that they could send or receive emails to those particular ones, and that's on a as addressed basis. You know, as the teachers come to us and say, we need this for learning, we'll address it at that point. So we do have a few whitelisted. We have also on the website, we have technology resources for the parents to help them know ideas of how to protect their students as well. There's a parent's guide to protecting their kids online out there that has guides to password security, identity theft, online shopping. It covers a whole gamut of streaming, video games, social media, messaging, sexting, cyberbullying, and parental controls that they can use to help keep their children safe while they're using the devices. As well as we have worked with the principals and we're coming up with plans to have the teachers teach the students using, and these are on the website as well, NetSmarts and Common Sense Media. These are two different sites that have videos, lesson plans, classroom activities to help teach the students how to be safe when they're used out on the internet as well. So we have those, and we're working to help the teachers roll these out. Also, and to address about the Chromebooks and the teachers using them in the classroom, Dr. Cliff Mims came in and was showing the teachers all kinds of things over the summer in services that they can use to engage the students with the Chromebooks in the classroom. So they will utilize the devices in the class. We had a great turnout for that as well. So, anybody have any questions for me?
Are those safeguards still in place when they take the device home?
Yes, sir. And the Aristotle, the filters are all still in place when they leave the building. And the Aristotle K-12 even monitors the sites they go to and flags them and gives us reports on inappropriate sites and so forth based on wording. And the teacher can see that part. And then, of course, Kevin and I, the content filtering, we can see as well.
So it's not dependent on the network, it's
No,
in the device?
It's the device itself, yes.
I have a couple of questions for you, Melissa. So the kids get the Chromebook, pop them in their backpack, take them home with them and stuff, right? And now when they or their parents sign for those, who's ultimately responsible for that Chromebook? Let's say, come in and say, you know, like textbooks, taught for a long time, kids used to lose their textbooks. They come in and say, hey, I lost my Chromebook. What happens then?
Well, that's where they have the opportunity to purchase the insurance to cover that, those instances. And then I guess we'll just have to address it based on the cases. If they have purchased the insurance and the insurance covers the loss, stolen, damaged, what have you, or if they do not have the insurance, then that would be a tech team and board decision.
Will you be doing what you used to do with textbooks, check the textbooks at the end of the year, and you'll check the Chromebooks at the end of the year and stuff like that, or what's the plan?
That is the plan,
That is
yes.
the plan, all right. All right, one other question for you. I remember back in the day, we used to have some, teachers used to complain a lot about being able to access YouTube and things like that. I suspect we don't have that problem anymore, do we?
No, it's open until abused. Right now, it was previously only open for teachers, but we've had to, because of the devices and such, they want the students to be able to do the video, so we have opened it up.
Okay, cool, all right,
So we are monitoring.
thank you.
Melissa, let me ask you this just real quick to follow up on Mr. Vincent's question. Let's say a kid comes in high school, the 9th grade, and they are assigned a device. They keep that same device all 4 years they're in school,
Yes,
correct?
that is the plan.
So it's not like just shuffled and they get a different one. They are
keep
responsible for that device.
They keep the same device all 4 years.
Okay.
But do they turn it back in the summer?
Yes,
Yes.
but we're using Destiny from Paulette to check it out, check it in, and the schools will check it out to them again next year.
Okay.
You tell them not to carve their initials in it though?
We hope not, and not to put anything, nice stickers or anything all over, it's okay to put your name, but the rest of it, leave it home.
That sounds good.
All right,
Thank you.
thank you.
Mr. James Fields.
Good afternoon.
Good afternoon.
For enrollment update, open enrollment, open enrollment is when the students transfer within the district. Open enrollment in 2020, we had 224. 2021, we have 265. And that's a good thing. That just means more parents are following the instructions to meet our window, which was May the 10th through the 24th this year, so they did a good job.
Mr. Fields, excuse me, are those ones coming out of district?
No, sir.
Those are within district, okay.
Correct. Special exemptions, 2020, we had 87. Thus far this year, 2021, we have 57. Now, the special exemptions is when the parents write a note for a hardship or a special request, but usually most of those are the people who miss the open enrollment. So we get a lot of that, but right now it's better, but I can't say it's gonna stay at 57 or 60. It just depends. First 20 days is usually whenever we get those letters. Out of district, 2020, we had 17. 2021, currently, we have 46. 12 returned, and we had 34 new. So that's great. That's great. We're doing a good job there. Overall enrollment in 2020 with pre-K, we ended with 10,375. Currently, we have 10,362. 2020, without pre-K, we had 9,997. Currently, we have 10,031, which is about a 34 student increase, which came from our out-of-district increase. But we still have several students that hadn't registered, but hopefully with the addition of our new social workers and court liaison and truancy officer, we can get those kids in as quickly as we can.
Now, when somebody moves in the area,
Mhm.
is open enrollment available to them? So they don't live here until December, is it?
Yeah, but if they move, open enrollment is not available, but they can ask for a hardship request. And there's a committee that determines, if it's approved or not.
Those 46 you're talking about, those are the ones that pay $750 tuition?
Correct.
Okay.
And we got 2 more to look at tomorrow, so maybe 48. I don't know.
I will say, Mr. Fields ran with that ball. I said, I think I gave him a goal and he knocked that goal out about a month ago and just goes by my office and grins about it. So he's gotten a lot more, because keep in mind, we get, you get the money, that tuition they pay, but then we also get the state match. We get that BP from the state for those children. So, that's been very beneficial for the budget, for sure.
Where do you say that most of it coming from? Anywhere in particular?
Mostly Shelby County, Millerton municipalities, but they're coming from everywhere. I mean, but the percentage are coming from Shelby County.
Okay.
All right. Thank you, Mr. Fields. Thank you, Dr. Bird. Director of Operations report, Dr. Fisher.
Good evening.
Good evening.
I wanted to share a little bit with you about transportation. We've begun this school year definitely with a driver shortage, and so we're currently down 30 drivers, just to make you aware, which definitely has caused a challenge for our system that transports with the large number of students that we transport every day. Our drivers are currently running their current routes, and then they're running additional routes each day. So some of them are running as many as 3 different routes a day, just to get the job done, and so we're very appreciative of that. So with these extreme temperatures that we've had this first week, we are very appreciative of their efforts, as well as Mr. Morris and the entire transportation staff. So we do continue to seek those individuals who may be interested in becoming bus drivers. We will work with them in the process with the written exam and learning how to drive. So we continue to ask you, if you know of someone who is interested in driving a bus, to please ask them to come and get into contact with us. So we have those applications every day. At this time tonight, I'm gonna bring Ms. Sherry Yarbrough and one of our community partners, Mr. Parker Harris with Baptist Tipton, who will share some information with you, followed by Mr. Hunter Bennett, who'll give you the capital projects update.
Real quick on the drive, go ahead.
Go ahead.
You sure? Alright, are we paying our drivers for taking the extra route?
Yes, sir.
Good.
Dr. Combs and Mr. Marshall.
Okay.
We're actually working on
We're
that right now.
working, yeah, we're working on.
Yes, sir.
I don't wanna run off the ones we got.
No
Yeah,
kidding.
absolutely,
Absolutely.
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 Mr. Ship.
That was mine.
Oh, okay, have a good day.
Great mind.
Does that mean we have buses not running every day?
Yes, sir, because we're 30 buses down.
That's unreal.
So they have, what Mr. Morris did was actually reroute some of our routes so that drivers could pick up additional children. So, that's, I mean, but when you're 30 drivers down, you have to make it work. And so they have been making it work. Our principals, school administrators have been very supportive. Buses have been getting there a little bit late and leaving a little bit later in the afternoons. But we're still getting the children to school every day, which is, of course, the goal.
How has the new access road helped out at Munford schools?
Yeah.
Traffic.
That's a good question. I will say that,
Mr. Turner, I know, has monitored that
Correct.
and said it was going well. I would
Right.
say that, but we've had some other traffic issues at
right,
Mumford
you're talking about
Middle.
that new, now, you're not talking about the car rider drop-off at Mumford Elementary, is that what you're talking
Yes,
about?
that's what
Okay.
he's talking
And
about.
that one
Yes.
is working better. Matter of fact,
Yes.
Mr. Glenn's been out there watching it
Yeah.
to
he's
see how it
monitored.
flowed, and so far, we've had a lot fewer complaints about the amount of traffic, and the other indicator is that I haven't heard from Mayor Cole, I think it's working better.
That one's working, but I think we have more drop-offs at Mumford
We
Middle
do,
School
we
right
do.
now. So
We do.
we shift from one place to
All the way
another.
back to the fullest.
Yes, ma'am.
Yeah.
Yes, ma'am.
So,
But so far, that part's working better. I need to add a couple more.
Dr. Combs, when you started your career in our building, we asked the coaches to get their CDL. Do our coaches still have CDLs?
A number of our coaches still do, and that is a resource that we're trying to figure out how to tap as well. You know, when they leave, if they still have a class, if it's in the afternoon or the morning, we have to cover that. So we're just trying to work out all that, but yes, we do have a number of coaches who still have their CDL, and we're looking at that as well. Yes, sir. Yes, sir.
But we are also not the only school system that has a shortage.
I see.
Ripley has buses with hiring as well as Haywood County, so.
So does Durham County, Durham City.
Right. I think Dr. Fisher said the next step is start looking at school board members to drive. Was my understanding.
Is that legal? Can we do that? Can we drive?
I don't think you can. I don't think you can actually. But, I don't know, we can check that though, if you're throwing it out there.
I think Peggy Murdoch is waiting at home for the call.
Maybe.
I want the VA.
Come on,
Thank you,
I'll get up
Dr.
there
Fisher.
while everybody's still smiling and laughing.
You're not gonna bring good news.
Okay, well, good evening.
Good
And,
evening.
It feels like yesterday when this was a year ago. So I will be giving you your monthly numbers on cases and quarantines and stuff. You know, right now, the plan that we're under is just a very fluid plan, you know, looking at it, depending on how things are going, then we'll look at what we need to change to do better. But, of course, last year at this time, we were not in school full-time. So if I go back and compare it to what we had in August last year, there's really no comparison. So I'm just gonna give you what we've had since we've been in school. Right now, with Tipton County Schools, we have 50 positive students. We have 147 quarantined. We have 5 positive staff members and 3 staff members on quarantine. Now, I will tell you, those 147 quarantines are mostly household quarantines. We're not, right now, working with the health department to do all our contact tracing and quarantining. We have not sent groups of kids home because of a case in a school. These are cases where it's 5 or 6 kids in a family, one person's positive, so they all have to stay quarantined and isolate for those 10 days. So that's why that quarantine number is so high right now. The the way we work with quarantining and contact tracing now is our nurses, if we get a call that there's a student has been tested positive, we report that to the health department. The health department does the contact tracing. We will notify parents of kids who were in the same classroom that there could be a case, but they will be notified by the health department to determine who's a close contact and who needs to quarantine. That's not coming from us right now. So
Does the state require us to do it that way?
the state the state requires it, doesn't require it. That's through the Department of Health, the CDC guidelines with quarantine. We're doing it, our nurses are so busy right now with other things going on. Last year, most of our medically fragile kids didn't come to school. They were not face-to-face. They're in our buildings now. We've got nurses that have 3 and 4 G-tube feedings a day. CAP, they're having to CAP kids 2 and 3 times a day. Brighton High School's got 12 diabetics this year. Last year they had 5. So it's a lot of busyness in those clinics right now. So we're hoping that this will work with the health department being able to step up and do those quarantines and contact trace. We're willing to help. If the health department calls me or a nurse, we're gonna help them. But,
Does it still have the 2 rooms?
some do. Some of this, they had the choice to keep a sick room and a well room, and most, I think, do. A couple of them, there was just a lack of space, but they're working through that right now. But right now, the kids that are getting sent home are either those that have a positive case, a household positive, or those kids that are having symptoms right now.
Have all our nurses been vaccinated or wear masks?
They are required to wear masks at all times when they are in that clinic. They have not all been vaccinated, but they will be. But our nurses are contracted through LeBonner, and that was their announcement this week that they're requiring their employees to be vaccinated. Yes.
And to follow up on Steve's question, when you ask about, what did you ask about?
Did the state require?
Yes,
to operate?
so, really, that's the health department's job, is to that's what they're supposed to do.
Yeah.
Last year, we did that for them because the turnaround took so long. This year, we're seeing some similar lagging in that turnaround, so we have been having our LeBonner nurses start to help with that process again. It just takes too long for the health department to get back with somebody.
That's
So
what I was
anyway,
worried about.
yeah, so our nurses are helping on that.
And we've had some, gosh, none of us thought we'd have to be here again this year doing this, but a lot of the health department is calling and texting families, and some of the text messages are a little bit unclear, so the parents then call us to decipher what the health department's telling them, so that it's, quarantine times are very hard to explain because it can be different for a lot of situations, and they're not giving those explanations in a text message, so they do depend on us to explain that to them.
Dr. Combs, what percentage of our kids are wearing the mask? You got an idea?
I'd say 10%.
10%.
Not as many as I would have thought, no. Probably about 10%.
Dr. Combs, I read where from the State Department, the local boards can't require masks. Is that correct?
That is actually not correct. The local board, other than the governor, the local school board is pretty much the only other entity who can do that. Y'all can make a decision for this district because you have the power to do that. The LEA can do that. The LEA, or if the governor gives an executive order, he can grant that authority like he did last year to mayors to make that order. And you saw Mayor Huffman would make that. Parker was on the task force with us, so he remembers that executive order would give the mayors that authority. And like last year, he did that a few times. But then when that the last one expired, that last executive order, that power was gone. So basically, other than the governor, the local education agency has the ability to make that mandate for their kids. Yes, sir.
I don't know where y'all been getting phone calls or texts or what, but mine been ringing off.
Oh, yeah.
These parents don't want masks.
Mhm. Yes, sir.
And they want them to wear them wherever possible. And, like I say, it's every time I pick the phone up, that's what somebody's on it.
Yes, sir.
what you want.
I've gotten quite a few myself. I
I'll pass some on
believe we
down.
have some of our friends in the audience here tonight, so yes, sir,
I'll pass some on
we have
down
to,
you.
okay,
But I just wanna let you know that what's going on out there, they
absolutely.
do want to kids to wear masks.
And I think that's, you know, gonna be something for y'all probably to discuss this evening. And I don't know if, is Parker gonna?
Yes,
Okay.
and I was gonna introduce, this is Parker Harris, the Director CEO at Baptist Tipton. Just ask him to come give some local information about what's going on locally with COVID and especially pediatric patients.
Thank you, group, for having me. So I do have a little bit of data I did want to share with this group. Unfortunately, it's not a good picture. We've seen a rapid rise in cases specifically over the last 3 to 4 weeks. Tipton County has just shy of over 500 active cases in the county right now. And based on national and then zooming in on the local data, we're starting to see the age in which these individuals are positive. Usually, you know, in the early stages of the pandemic, we were seeing a lot of mortality and a lot of transmission among that elder population. We're seeing that age range drop dramatically. We're seeing over 15% of the newly active positive cases are in the 18 or under category. The highest rate of transmission is between the 14 to 18. So of that 15% of the positivity rate that is in the pediatric population, that 4-year span of 14 to 18 seems to be the most transmittable age range that we're seeing. This Delta variant, it is a real thing that's right here in Tipton County. The Delta variant is very difficult to test for because it takes multiple days to get the test back, so a lot of physicians aren't testing for it. But based upon estimates, we're estimating over 80% of the transmission in this county right now is most likely the very contagious Delta variant that is attacking that pediatric population. In addition to COVID in the younger group, we're also seeing a lot of RSV. And many people might say, well, RSV's been around a long time. We always have RSV. We don't usually have RSV in the summer months like we're seeing it right now. And the reason why is we've all been cooped up in the house. We've all been masking. We've all been socially distancing. These younger children have not been exposed to this virus in the natural state they would have been if they would have went to school last year, would have went to Walmart. So we're seeing now that they're back in these more public settings, more close quarters environments, we're seeing the rate of transmission for things such as RSV drastically increase. A report got released by the Commercial Appeal 2 days ago, I believe, that announced that it's an estimated within 2 weeks, all pediatric hospitals in the state of Tennessee would be at capacity due to mainly RSV and COVID transmission. So unfortunately, there's not much good to share. And it's not just pediatrics. We're seeing it with adults. I've got 4 ICU beds that are all full with COVID positive patients right now, and med-surg beds that are also equally full. So seeing rapid increase in volume. Our emergency room in Tipton County, if you read the newspaper this morning, you would have read that we hit a record high for the last 60 years. Out of the last 60 years, we've never seen over 110 patients in a single day in our emergency room. We saw 119 patients in one 24-hour window last Sunday. Of those 119, 64 of those individuals came to seek COVID testing and symptom management. So the rate of transmission is real. The rate of transmission continues to skew to a younger population, and we're seeing things such as RSV also impacting that population. And I'll be honest with you, I am quite nervous about what the upcoming flu season might look like if we use RSV as an indicator of what could potentially happen. So I'm happy to answer any questions the board may have on additional data points.
Are we a hotspot now?
I think we've been one. We remain one. We're averaging well over 30 new cases per day just within the county borders. I believe, I don't quite recall our active per capita rate, or our active positivity rate. It's well over the 10% hotspot metric.
17.2.
17.2. My local one at the Tipton ER and Tipton Laboratory is closer to that 30 percentile mark.
We had 493 today at the end of the day.
Yep. Active.
If you got to make the decision for the schools, what would you do?
I have seen, I'm an accountant, I'm not a clinician. I have seen data out there. We've seen success at the county level every time a mask mandate was implemented at the county level. we saw a drop in cases. We're seeing a rapid success with the vaccination efforts and the reduced transmittability and capture rate within a vaccinated population. But we've even seen early successes with other school districts throughout the country who haven't issued a mask mandate. And we've also, in contrast, seen in Georgia, school districts who didn't, and they've had to go back to virtual. So there's very little data to prove what this board might want to do or not do. But the preliminary data and the data we have from our learnings over the last 18 months would support mask mandates.
Did you know, to my knowledge, now tell me if you're familiar with this, to my knowledge, there is no study, double-blind study with all that kind of stuff, that says masks help fight COVID. Can you tell me a study that I can refer to?
So an actual scientific study blinded with peer-reviewed, et cetera. I'm the accountant. I don't typically research that information.
There are none.
I can tell from the county level data in which we saw Mayor Huffman issue mask mandates 2 different windows of times. We saw cases decrease at the county level, and we've also seen it nationally. When mask mandates were implemented, cases dropped.
When we're talking about kids' health, I gotta err on the side of caution, so I'll make a motion to require masks until the next board meeting.
Some districts, Steve, do it for 2 weeks. In other
We
words,
won't meet in 2 weeks, though.
I know, I'm just.
That's what, I don't want it to expire. I appreciate that, but I don't want it to expire.
Are you seeing any vaccinated people with COVID?
I can share a little bit of data on that. So Baptist Hospital System, I'm actually going to quote the data so I don't misrepresent it. Over the last 7 months, Baptist has kept track. So we chose 7 months because 7 months, the vaccine's been available to the public during that whole window of time. Baptist has had 6,608 individuals admitted to one of our 22 hospitals across the 3-state region that has been COVID positive. So 6,608 individuals. Of those 6,608, only 30 have been vaccinated and admitted to a hospital. So that's not the exact data point you asked for because it's very hard to give the actual individuals who have broken through and been positive once being vaccinated. But I can tell you from the hospitalization data, it strongly supports if you get vaccinated, your chances of getting admitted or being severe enough to go to an ICU, very minimal.
We have a motion on the floor and we're, by Mr. Clark to mask until the next board meeting, a second by Mr. Joyner. Now we're open for discussion. Now continue if y'all want to discuss.
I want to ask Sherry a question.
Okay.
If parents have their children wear masks at school and masks will keep people from getting COVID, why will that not suffice? If a kid wears a mask to school because their parent is concerned they'll get COVID, why is that not sufficient if a mask works to keep kids from getting COVID?
So you're saying just those who the parents want to versus mandating it for everybody? Because you still got germs being coming out from other kids.
I'll tell you the reason
One at a time, Mr. Clark.
I'll explain why I made the motion. I learned of an individual that was tested over the weekend, and she got a positive test. She knew she was positive. She came to school. The health department didn't get and I'm not throwing the health department under the bus, but the information lagged. Didn't get to the school in time until they didn't catch the student there until 4th block. So they had been at school all day positive without a mask. And so if we don't make it mandatory, some people just aren't gonna follow the rules. I mean, if everybody would follow the rules and stay at home and they don't feel good, we wouldn't have to do this. But they're not doing that. And so, man, I just can't live with the fact that if a child contracted it, and God forbid they pass away, and we didn't do everything we could do, it'd be hard for me to live with that.
Mr. Shipley, you had your hand up.
Well, Mr. Vincent, I've read a lot, and this isn't coming from a defined research, but sometimes real life is better than studio research. And the people who wear the mask are protecting the other person. It doesn't protect them. It helps protect the other person. It's kind of like some people don't like to wear a seatbelt.
Right.
Well, you've had a lot of accidents where the driver was thrown out from under the steering wheel and they hurt someone else. So a seatbelt don't only protect you, it protects other people. From what I've read, and I've read a lot about it, the mask protects you more than me. And if those folks who choose not to wear a mask, it's like the ones choosing not to wear a seatbelt. That's my perception. Is it right or wrong? I just want to share it with you.
Well, I think that we should, go with the recommendation of the, health department and the, CDC. I think that,
They're the professionals.
and you have a fire, the fire department is in charge. You have a crime, the police department is in charge. And, we have a pandemic, then the experts should be in charge. And we should add on their recommendation, whatever they recommend.
Mr. Vincent?
I was gonna say, how many children dying of COVID is too many? One.
That's one too many.
It is one too many. Now, I read today, just to put things in perspective, I read today, because I do a lot of reading too. I read today that since the pandemic began, children 18 and below, 245 have died across the United States. And that includes kids that may have had influenza, they perhaps had diabetes, were morbidly obese, they had other things going on as well. So 245. Now, one is too many, right? But remember this now, what your mama used to tell you, this squeaky wheel gets the grease. Richard says he's had a bunch of phone calls about people putting masks on. I would be willing to bet that 75 to 80% of the county would tell you otherwise.
Mr. Vincent, we're not gonna politicize this.
I know,
No, we're
but
not
I'm just
gonna do
telling
that.
you, I'm representing my district when taking a vote.
But I'm not letting CNN or Fox tell me how to do my job on this.
Ms. Sherry,
Yeah.
is there any harm in wearing masks? I mean, no identity studies that,
No, and if there are children who can't wear a mask, like last year, we had medical exemptions for those who were not able to wear a mask.
Not breathing CO2, I've read that study, no?
You can read a lot of things, I've read, you can find anything you want. If you're looking for stuff against masks, for masks, because being the school health person, a lot of stuff comes to me. I've got lots of emails, both sides, and all I can go about is what our numbers look like. And if wearing a mask stops these numbers and keeps our kids well, then why not keep wearing the mask? If it doesn't, we'll revisit this again in September and say, but we also encourage vaccinations, but we want to do whatever it takes to keep these buildings open and our kids learning. Because there's a whole lot worse going on when they're not in school than whether they're going to wear a mask or not.
Is there any more discussion?
Yeah.
Mr. Jordan?
I just want to let y'all know, I've got a 12-year-old that's in school up next to Nashville. And he's got it, he did have it. And it's hell. We can't talk to him, we can't see him, can't do nothing with it. But people need to get this stuff in their minds and straighten it out. It's gonna get worse before it gets better.
Well, I'll say if we do it, I'm like, we do it for the kids. We don't do it because some of the parents are complaining.
Right.
We do it because it's the right thing for the kids, because you're gonna have just as many phone calls, or maybe more if you mandate it. So I want to put that out there.
I'm not worried about it either.
I didn't choose to be on the board to make life and death decisions for other people's kids.
Yeah.
Never thought I'd be in this position. And so if I am, I can't just think about my kids, man, they're healthy. God's blessed me. I've got 2 healthy kids. Not all these 10,000 kids are that way. Some of them have asthma, some of them have breathing conditions. And So I have to make that vote for them. I'm gonna be the least popular person when I go to my house tonight. That's something I gotta live with, but they'll get over that. I wouldn't get over if a child died because we didn't do everything we could. And so maybe I'm taking it too far. It's been 245 in the country. I don't want there to be one in Tipton County.
I agree.
I'm not saying that, I'm just saying, I'm just putting.
Yeah, I feel like I made the motion
Yeah.
to take it off, and I made the motion to put it back on, and so folks need to know where I stand, and I get that folks aren't gonna agree. They have that right to not agree, but I hope they can understand where I'm coming from.
Any other discussion?
I have the greatest respect for your position, although I disagree.
I understand,
That's,
and I appreciate it.
all right, are we ready to vote? All those in favor say aye.
Aye.
Those opposed, no.
No.
Abstain.
You got one no and one abstain. Motion passed.
I will say, I would like to make this recommendation, if that's okay. I do like the idea that, just like, Parker said, and we've heard earlier, I do think it's worth, every board meeting, I think it's worth revisiting, just to see, how's our case count, how's things going. And probably, we keep going like y'all's vote, but it doesn't hurt for us to look at the numbers and just see, because we may need to adjust elsewhere too, so. I just make that recommendation that, and y'all just take it as you want.
You and Ms. Yarbrough's gonna work the verbiage out.
Yes, Ms. Sherry and I will work on the verbiage tomorrow, and so we'll get new information sent out to parents and everybody. We'll reload the webpage, and then we'll get it ready for Monday. We need to give us a day to get all the stuff together, and then we'll have it set where it's active on Monday. Is that okay? Is that okay with the board?
Yeah, and let's leave the playgrounds alone. They can,
Right.
Yeah.
I don't know that we've seen any studies where they're gonna pick it up off the playgrounds.
Okay. And the teachers are doing a pretty good job of making sure they, wash their hands before, after, not getting each other's face, all that kind of stuff. So, I mean, yeah, we can start here. But we'll work on that starting tomorrow. Ms. Sherry.
Anything else about, playgrounds will be open, TWSAA, we're still the same on everything, all
Right.
sports will be like it is.
Yes,
Now,
sir.
it won't be mandated on sports, because TWSAA is over there.
Right.
This is just for in school, and,
That's right. If sports were to, if anything were to change there, we'd have to get word from TWSAA. They're the
Correct.
ones that set that. Right.
Right, so we're good on that, so
Yes,
everybody.
What is socially distanced now? Is it 3 feet or 6 feet or?
Should be 3 to 6.
3 feet.
3.
3 feet, but if you're contact tracing, it still goes within 6 feet. So
Okay.
you can be 3 feet if you're still, and wearing your mask, maybe, then, but if you're contact tracing, we still look at those that are within 6 feet.
So like 3 feet for a high school, but like 12 feet for a preschool?
For a
Because they're always moving?
Because they're everywhere.
Okay, that's, moving along. Mr. Hunter Bennett, Capital Projects Manager, on the roofing update.
Good evening.
Good evening.
Good evening. This is gonna be a little bit more positive topic. Let me start off with saying, that yes, the heat has kind of slowed a little bit of progress, but we haven't stopped. You'll see here that at Crestview Elementary, our roofing contractor has agreed that he will provide me with some nice footage here of a drone footage of Crestview Elementary that is completed. We were able to get them done before school started, which has been nice. Trust me, Drummond's, as you will see here, as we started at Drummond's, there's much work needed and reserved there. That's some of the decking that we've experienced throughout the county. These are what the teachers have been battling for years, and much needed repairs.
Are they getting all new roofs or just quite a lot of roofing in Drummond's?
As you can see here at Crestview Elementary, our goal is to, before it's over, we're hoping that they're all gonna look. Now, we still have some more funds that have to be approved in order for it to be countywide. So we do have a few that that aren't on the list. They're on the list, but we don't have the funds approved at the moment. Drummond's Elementary, as progress, as you can see, guys, I mean, they're moving right along. The roof is, as you can see, the old roof here in the middle picture, well, that's a Mumford High School shot, which is moving along rather well. But the Mumford High School that indication of the old black rubber roofing, obviously that's absorbing heat. It's being transferred down into the schools. The white TPO here that's going on, it's reflecting it. The guys that are gonna have to work up there are gonna feel the heat, but you're not gonna see it. You're gonna see the benefit coming on the electricity bill. It's reflecting out, but our maintenance guys, we're getting them some sunglasses. To work on these roofs, that came across today. And then as Mumford High School, as you can see here, we're getting close to the finish line. As you can tell in the picture there on the left, there's a pressure washer there, so these guys are taking it one step further per request of, we want a new roof, guys. We don't want one that's just new material, we want one clean. So they are taking it one step and actually pressure washing these as they're getting close to the finish line. And Mumford High, with the heat, and the amount of units that are on the school, the size of it, we're hoping for another 2 weeks, and we're gonna be off of that school, and then we'll be moving to Mumford Elementary from there. Mumford Elementary will be where the crew that's at Mumford High School, they'll be moving to Mumford Elementary, and the one that's at Drummond's Elementary will be moving to Brighton Elementary whenever we finish the drawings. So it's a lot of positive things going on with it, and then hopefully we'll have some good news here soon to move into these bathrooms. That'll be a fun project that we can look forward to tackling, that you'll have some concerns about when we get into those. But, does anybody have any root questions?
I think Miss Belinda and Dr. Fisher can attest to the roof work going on at Drummond's, because they walk there in the mornings and they said they hear hammering before it's light.
5:30, they're working at 5:30 in the morning.
Well, their start time, they've been climbing on the roofs every morning about 5 o'clock. And the goal is to only tear off what they can actually put back on that same day. So, the guys have been a pleasure to work with. Communication has been, I've been doing construction for a while now, and it's been very nice to actually have someone to call you with reports daily, hey, whenever I'm up there, hey guys, would you just let me know, everything's buttoned up properly. I've been very pleased with the company that was selected for the project.
Any other questions for Mr. Bennett? Thank you, Mr. Bennett.
Thanks, guys.
Financial report, Mr. Billy Darby.
Good evening, ladies and gentlemen.
Good evening.
You should have in your packet there a copy of the resolution that was presented to the county commission for us to enter into the Smart Buy Cooperative Purchasing Program. This is a program that opens us up, kind of like the state contract. It just gives us access to more vendors and purchasing from bulk pricing with other districts. And so that was passed at the July term of the county commission meeting. A copy there for you to read. Also, you'll see inside the financial report for the month of July, the second page there is the general purpose school budget 141. The revenue for this year so far in July was $147,118.87. Of course, we're budgeted $85,156,700. As far as expenditures, $1.4 million. Flipping over to the federal projects budget, revenues a little over $70,000, expenditures at $124,000. Total budget this year 5.6 to start, but obviously we all know that'll change. Last year we were about the same number, ended up at like 21 million with the federal funding. I anticipate that to be the case again this year. Cafeteria for 143. Revenue is a little over 40,000, expenditures at 143. Budget again is the mirrored budget from last year for food service, 5.7. And then our capital projects budget, we're trying to, there's been no revenue in that budget. The money that's left to spend there, of $102,000 that started the year off, is to finish the projects up at Brighton High School, and that money should be gone. We should be done with that budget hopefully by this fiscal year. We can close the 177.
Are there any questions about the financial report? Do we have a motion to approve as presented? Motion by Mr. Jordan, second by Mr. Clark. Those in favor say aye.
Aye.
Those opposed, no. Thank you, Mr. Billy.
Thanks, sir.
Y'all are way too easy on Mr. Doherty.
What
in the world?
We afraid he might be joking.
he's doing a good, fine job. I'll say that. Dr. Combs, do you have anything to add?
No, sir, just appreciate the support. Like we said before, I've gotten plenty of calls before, I'm gonna get plenty of calls now, so, the best thing that we have to know is, we need to do what's best for kids, and I'm telling you, they need to be in the building learning, so however we can do that is the best. So, thank you, I appreciate that.